Hello, my name is Jessica Smith, and today I will be talking about Paget's disease of bone. Basically, what Paget's disease is a bone disorder, specifically the disorganization of bone remodeling. In this presentation, I will be going over the causes, symptoms, cures, and lots of other important information regarding Paget's disease. I chose this disease because I felt like it suited anatomy and what we've learned throughout the class this year so far. In 1877, Sir James Paget discovered Paget's disease of bone. He actually became one of the founding fathers of pathology, working alongside Rudolph Virchow. He discovered Paget's disease of the breast and Paget's disease of the bone. In 1876, James Paget published a paper which he called Osteitis deformans. His paper described 5 cases of a chronic bone disease, and his main case was of a man who he had been observing for over 20 years. The patient was a 46-year-old coach who first visited St. Bartholomew's Hospital in 1854, suffering from pain in his lower limbs. Dr. Paget observed that the patient's left shin bone and his left thigh bone were enlarged and misshapen. This man was diagnosed with what is now known as Paget's disease of bone. In today's time, Paget's disease can now be identified through an X-ray. There are other ways to diagnose it, but an X-ray is the most commonly used. It is actually common for patients to be unaware of the disease during early stages because symptoms of Paget's disease develop really slowly. Paget's disease of bone most commonly occurs in the pelvis, skull, spine, and legs. Paget's disease can also be really easily confused with as bone cancer. However, this is not the case. The disease cannot actually spread from bone to bone. Also, Paget's disease will not affect a person's overall health, but will cause a lot of pain and discomfort. Scientists expect a combination of environmental and genetic factors contribute to the disease. Several genes appear to be linked to getting Paget's disease. Besides Paget's disease, many diseases are a result of homeostatic imbalance, which is the inability to restore a functional, stable internal environment. The bones affected by Paget's disease are poorly mineralized. This can be characterized by excessive and haphazard bone deposit. As of right now, it is still unknown what the main cause of Paget's disease is. Let's now talk about the symptoms of Paget's disease of bone. The main symptom is pain. The types of pain can be categorized into either bone or joint pain, but overall, pain is the biggest symptom. There are underlying symptoms that can be paired with Paget's disease. For example, when Paget's disease is active in several bones, overactive osteoclasts may relieve enough calcium from the bone as they break it down to cause an elevated calcium level in the blood. This rare complication can lead to a number of symptoms, including extreme fatigue. Other underlying symptoms are constipation, weakness, loss of appetite, abdominal pain, and many more. Also, depression is extensively described in Paget's disease, which has been shown to be affecting up to 50% of the patients. In Figure 1, you can see results from 103 patients with Paget's disease. The figure shows the location of where the disease was on the patient. And in the graph, the most common in this test group was the pelvis and the least common was the ribs. In Figure 2, you can see through the X-ray of the pelvis where Paget's disease has taken over. The ilium and iliac crest are enlarged on the right lateral side of the body, causing discomfort and pain for this patient. Now, how would you know if you have Paget's disease? There are 3 main tests to indicate if you have the disease or not. Like I said before, the most common test is an X-ray, but a blood test and a bone scan will also diagnose a patient with Paget's disease. Patients tend to be asymptomatic during early stages, which can cause an accidental identification of the disease when one of these tests are done for whatever other medical reason they may have. But X-rays are typically used to make the final diagnostic. Finally, I'm going to talk about treatments and cures. Or I would be talking about treatments and cures, but actually, there is no cure for Paget's disease. However, if the symptoms, like pain, become unbearable, there are some treatments offered for patients to alleviate the pain. Osteoporosis prescription drugs are the most common treatment for Paget's disease. This can either be taken by mouth or by an injection. Other medication that could be used are alendronate, which controls osteoporosis and Paget's disease of bone, but it does not cure the symptoms. It may take 3 months or longer before your bone density begins to increase. And it generally works by slowing bone loss. Fosamax is another drug similar to alendronate. Actonal decreases the rate bone cells are absorbed. This This reduced absorption allows the body to increase bone density, which in turn reduces the risk of fracture. And finally, reclass, which is similar to actonal, but patients taking actonal show a bone mineral density increase of 2.7%, while those taking the reclass show an increased bone mineral density of over 4%. Paget's disease most often affects older people, occurring in approximately 2 to 3% of the population over the age of 55. Paget's disease of bone can sometimes lead to further potentially really serious problems. Over time, enlarged and misshapen bones can stress nearby joints, leading to osteoarthritis in those joints. In very rare cases, though, Paget's can turn into a life-threatening cancerous bone disease. I decided to choose this disease because this is something my generation can try to avoid. With the understanding that this disease may be caused by genetics, there are some ways to prevent the disease in your future life. Eating well, exercising regularly, and preventing damage to your body can decrease the chance of getting Paget's disease or even furthering the stages of Paget's disease. Lastly, I did add 2 more pictures, figure 3 and figure 4. In figure 3, you can see the top row of the skull is what is the normal skull, and then the bottom row shows the deformity of the skull with Paget's disease. And in figure 4, you can see that the tibia and fibula of the patient's leg is deformed and it is misshapen, and you can see that in the view of a x-ray, and you can see that from the view of straight eye. Thank you so much for listening to my presentation. My references are on the bottom left.